Health officials in West Texas confirm an unvaccinated child died from measles. This is the first death linked to this outbreak, with more than 120 cases that started only last month. It's also the first death from measles in the U.S. since 2015. Joining us to talk about that and other health topics is Dr. Bill Hartman, clinical trialist at UW Health. Good afternoon.
Thank you.
You know, measles, most of us will say, yeah, I remember that. That's the MMR vaccination. But sadly, not all children these days are getting that vaccination.
Right, and in this particular community, there's a very low vaccination rate, and so it was ripe for for measles outbreaks such as we're seeing. It's actually somewhat concerning right now. Last week, the number of cases here was 34. This week, that number is up to 124, with at least 20 of these kids hospitalized, and one of these children has passed away, which is very sad. This is a vaccine-preventable disease, and even one death from a vaccine-preventable disease is too many. We have to make sure that we keep our vaccination rates up so that we can keep these outbreaks at a minimum.
What age are kids recommended to get the vaccine, and what assurances can you give parents who are a little bit concerned about it?
So these are vaccines that are typically given to sort of infants and toddlers at 12 to 18 months, and then again between 4 and 6 years old. And so it's a two-shot regimen that confers about 99% immunity for a lifetime. And so it's very good. The people who are vaccine hesitant oftentimes are so because of worries about side effects that can happen because of these vaccines. But these vaccines have been around for a very long time. They've been exhaustively studied. They are safe, and they prevent terrible diseases like measles from happening in communities like the one in West Texas.
Let's move on to antidepressants. There's so many of them out there. They're marketed widely on television, but there's now a study that says that there could be a link to dementia.
This came out of the Karolinska Institute in Sweden this past week, and it's actually somewhat confusing. And I think it says actually two things in their paper or in their study. The first, an observational effect that as people have worsening dementia, if they are on depressants, then they seem to have a quicker cognitive decline. But later in the study, they also show that when they give a mini mental state exam, which is a test for cognition, that people who are on antidepressants actually had slower decline. And so I think it's really hard to take anything out of this paper other than more research has to be done, because clearly there is something here that antidepressants are associated in some way with cognition in people who suffer from dementia. But at this point, we don't know exactly what that is, and we just have to be very careful in how we interpret these things and not make any judgments right now.
And with our population aging, this is something that we definitely need to continue to study. Doctor, thank you so much.
Thank you.